Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah Ann Court, Dublin, California 94568. Phone number 408-687-1899. And I'm here to deliver another lecture of health education lecture series. As you know, every day from 5 to 6 p.m. California Pacific time, I'm delivering one lecture every day in a different language, sometimes in English, sometimes one day in English, one day in Punjabi, and one day in Hindi. And yesterday my lecture was in Punjabi, and today I will deliver it in Hindi, in English. So let's start with the English lecture for 2 days. The same thing I have to repeat mostly. Main things. Yesterday I was discussing about that if ever you are suffering from any problem, any health conditions, and you are not recovering from the present treatments, whatsoever you are taking, and you want to get a second opinion about your disease as well as of your treatments, then you can call me. Based on my 52 years of experience, I can just guide you based on the natural principles. And I told to everyone many a times in these lectures that even when before there was no medical science, even then people were becoming sick and were getting cured. What was there at that time? There was a natural process. Nature itself was curing the persons according to the system set up in this body by the natural ways. So now the medical science has studied all those ways, how the different diseases were cured, what was happening during the course of the disease, and what was happening during the course of their treatment and progress. And ultimately, they were cured. That's why we have knowledge nowadays that some of the diseases come once in a life, some of the diseases may come repeatedly, or some of the diseases may come 2 or 3 times in the life. Previously, it was not. Just like the pox, we were considering that this is coming only one time in life. But now we have cases when it has occurred many a times. But now, uh, furthermore, we have that when it comes at the old age, and its name is changed, the shingles. From the pox, it becomes shingles. But even then, the same herpes zoster virus is responsible for this one, and the same pattern of eruptions is coming up on the skin, but it has a different route. The other eruptions were coming up on the abdomen or on the arms and on different areas at the different sequences. Whereas the shingles mostly they follow the nerve route inside the body, and the eruptions are coming up nerve on the nerve roots, and they are very painful. And ultimately, all these things we have studied that the pattern of the eruptions were the same, just like for the pox in the childhood. The same pattern was followed up by the herpes zoster to produce the eruptions on the skin, but they follow the pattern of the nerve roots. So in this way, all these things were happening in the past and also were being cured by the nature itself, because we were not having any alternative. We were not having any knowledge about that one. And when we were not having any knowledge and alternative to cure those things, nature was curing. The life was still surviving. The life was continued. Though there may be some incidences when some of the people may die during the course of treatment, during the course of recovery by the natures. But many of the things we have learned from the nature, and we have made some arrangements that there should not be any casualties, deaths during the treatment. Uh, and in this way, we have added something to the nature, depending upon the requirements, demand of time to time, which is changing according to our food changes, according to our environment changes, according to our all adaptations of the body. many things are changes. So with the change of all these things, many things in the treatment and in the course of recovery has been changed, and we have improved that one. We have improved those things, and we have learned from those all those things. So I'm talking about that when there was no medical science. When there was no medical science, even then the persons were recovering, though there may be more casualties as compared to today's time, because there and nowadays there are very low percentage of the recoveries. Previously there was a big you can say the large number of deaths were happening during the course of disease. Even the simple diseases, sometimes people may die because there was a complications and there was no precautions. There was no guide to us so that how we can take the precautions to protect ourselves. The humanity was being dying because of those things. But nowadays we have changed something. We have added something to the natural processes. So in these lectures, time to time, I'm giving you the knowledge about those things. Even what was when we were having no any medical science or no any written documentations or any set agenda for the cure of a particular type of diseases. But now we have, and what we are doing at this time to time, what has changed in that process, I am guiding you in these lectures, so that every person should be aware of the present situations where we are at this time for the cure of the diseases. Every time whenever anything happens, just like endemics, we were worried about that. We were worried about that, and thousands and thousands of people were killed, even at one place, and even in the different scattered countries to countries, people were dying with some of the endemic diseases. But ultimately, we are at this point now that if ever anything happens like this one, the endemic type of diseases, or in the viral type of condition, just like the COVID-19, you might have just heard recently. There are previously many more, and this kind of things happened in the disease cycles, and people were dying in thousands and thousands in various countries, country to country. But nowadays, just like in COVID-19s, uh, we have learned many principles which are guiding us, whether the diseases are from the fungus, whether the diseases are from the protozoas, whether the diseases are from bacteria, whether the diseases are from the viruses sections. So now we have studied about all these things, and we have a precautionary line that how we can protect ourselves and how we can protect the others who are not at this time infected with these kind of things. And people were dying even with the fungus. People were dying with the protozoas. People were dying with the bacteria, just like the tuberculosis and all others. And people were dying with tuberculosis. And there are many more other diseases, when the meningitis. And many more people were dying with the bacterial type of diseases. But now the viruses, with the viruses, people are dying in thousands and thousands in one place. But good thing is that we have learned from the past, and we have recovered from the past, and now we have means how to protect ourselves, how to protect the life from all these type of threatening diseases. And we are able to create any type of vaccinations. Whatever disease is coming up in a new phase or in a new name, in a new type of natures affecting the human body, is killing the human bodies, and very shortly we are able to capture that one. And we are able to capture that one, and we are able to prepare the medications from those things, from the toxic substances. Yeah, poison kills the poison. Normal natural formula is that we have recovered, we have learned from the nature that the poison kills poison when they are different in kinds, similar in their manifestations. This is a natural formula. And we have adopted it, especially the homeopathic system taught us about this one, that poison kills poison when both are different in kinds and similar in their manifestations. Means, suppose if anybody takes any poison, and that poison has produced some toxic substances which may kill the persons. But nowadays we have other alternatives which can antidote that type of poison. How they antidote it? That they are able to produce similar type of poison, similar type of toxicity or symptomatology in the patients. And ultimately, when we know that the poisonous toxic substances has been evacuated from the body by our efforts, by vomiting, by excretions of anything, of the urine, of the stool, of the sweating, and everything that has been excreted from the body. And now we have withdrawn our medications. This is a systematic formula. It's a systematic step-by-step study that we have knowledge about. And now we are doing the same thing. The same thing has happened with the COVID-19, that immediately after it was killing, and we know that it is endemic disease and it's covering countries to countries, and every country was having millions and millions of deaths because of the COVID. And ultimately the scientists were working on that one, and scientists produce immediate vaccination. They are different in kinds. COVID virus has its own natural shape. They were affecting the human bodies, producing their toxins inside the bodies, which was blocking many of the vital functions outside the body, and the peoples were killed. Just like the respiratory and all those things, they were affecting, and ultimately the patients were killed. But now we have another alternatives. We produce the alternative that is known as vaccinations, and we produce the vaccination of different kinds which are capable of producing the similar type of effects inside the body, but they are also neutralizing the effects of the previous viruses. And second thing, what we know, it's a good thing, maybe by the nature or all that, because nature wants to survive the life. They do not want to kill the life on the earth. So that is why the other thing is that the fungus has its time period, which is very long time periods. People may suffer sometimes generation to generation with the fungus type of conditions. And many years in one person, this fungus can grow in the different areas of the body, in between the fingers, in between the joints, or various places. And after that, the protozoas. Protozoas are also, because there was no purification of the water, there was no purification or the protection from the earthworms and all those things, and they were entering inside our body, and even the food was contaminated. But we were not knowing the measures, how to clean the food, how to take measures to make this food adaptable, make it food that our body can adjust without any other untoward complications with this food. There are many more foods they can cause complications when we eat them, because we have no any type of precautions from the natural substances what they are having, and how we can protect them. But now we have precautions, and we can purify our foods, we can sanitize our foods even. And in this way we are protecting all those things. The similar things was happened with the protozoas. They were going inside our body, and they are developing inside our body, and ultimately they were growing too large, and ultimately peoples were gradually dying with those ones. And even it has been learned that those protozoas are reaching with the bloodstream, their eggs are reaching with the bloodstream to the brain, and even sometimes they may cause damages in the brains, and ultimately people were dying with the paralysis and all those things. These are the complications of the protozoas, and we learned about that one. And that how the protozoas are causing or entering inside the body. Now we learned about that one, and we are taking the precautions for that one. And even we have generated the medications which can kill the bacteria without causing any harm to the body, and they can kill the these protozoas inside the body, and they are evacuated by stool from the bodies itself, as long as they are not complicating the body, as long as they have not reached up to the brain level, and they are causing problems over there, and they are reaching to the other organs causing problems over there. So if they are not complicated, we are able to cure them by killing their eggs, killing their development inside the intestines and all that one. So after that, just like the bacterias are little minute organisms which we can see by microscopes, not with the open eyes. Fungus was easily visible by the eyes. Protozoas are easily visible by the open eyes when they are out, but when they grow their eggs and all those things, we are unable to see that one. But ultimately, the third stage of disease-producing organism is the bacteria. So those bacteria are visible only by the microscope, not by the open eyes. So you can well imagine that when there was no microscope, when there was no that kind of artificial eyes, which can activate the vision. So ultimately, they were freely moving inside our body. And when they were freely moving inside our body, they were causing problems. And ultimately, there are different kinds of bacteria, Diplococcus, Staphylococcus, and just like acid fast bacillus, gonococcus, and many type of bacteria are there, which are causing big harm to our life, and many of the diseases which were killing the persons with their virulency. So ultimately, we have learned about that one, that how we can kill those bacteria. And ultimately, we are competent nowadays to recover from that kind of problem of the life which is caused by the bacteria. The third stage came to us, that is the virus. The viruses, as I have told you many a times in these programs, that viruses are again a tiny substances which needs to be visualized by more microscopic lenses. They can see more minute things, not with the simple microscopes. They are not visualized. So ultimately, that has become again a challenge for the humanity. Maybe next day, something else may come up on the system, and then we will be fighting with that one. But we are now knowledgeable. We have a knowledge how to detect the enemies and how to kill them. Any type of enemies. We have passed a course from fungus to protozoas to bacteria, and now we are at the this viruses. Viruses were a big challenge for the humanities, because viruses are a hidden type of enemies. Hidden type of enemies, just like a friend becomes enemy. It's very difficult to point out your friend that he may be your enemy. But if he's causing this type of problems, ultimately at end, that you may know that your friend was your enemy, but ultimately this is happening inside the body, because as I told you, fungus has its specific space inside the body, folds of the skin, joints, and all those things. Bacteria, all the bacteria are having their specific affinity, specific space inside the body, just like gonococcus. When you talk about the gonococcus, our immediate attention goes toward the sexual organs, that it may be from there. If we talk about the tuberculosis, nowadays we are well aware that tuberculosis may happen in any of the organs, anywhere. But mostly, when a person is talking about the tuberculosis, we immediately our attention goes to the lungs. Nowadays, some more intelligent people know that yes, there may be a bone tuberculosis, and but nowadays there are various other sources where there are other sites inside the body where this tuberculosis may happen because of the acid fast bacillus. And the bad thing about the viruses is, which I'm going to tell you, bacteria are having their specific home As I talked about that gonococcus and this tubercular bacillus in the lungs or bones, and the same way there are Diplococcus, Staphylococcus, pus-forming bacteria. Whenever there is any condition where there is a pus formation, those bacteria we can visualize from there one. So ultimately, all these things are having their proper site. You can say the home. They have their home where they are living inside the body, and we can find them out. Something is coming up from the urethra, genital organs, and we check that pus, and we see the gonococcus. The same way, we check the sputum, and we find out the Aspergillus bacillus. Oh, you have tuberculosis. Same way, all the different bacteria have their different sites inside the body, or the excreta, which is coming up out from the body. Excretion, which is not being used. I told you yesterday's lecture that there is a secretion and excretion. Secretions are which are used inside the organ. They are produced by one organ, they are used by the other organ, just like the bile, just like the insulin, and many other type of hormones and secretions are being used, are produced by one organ, and they are used by the other organs for their own functioning. But the excretions are those secretions which are liberated out of body, and they are not used again. They are not just like stool, urine, sweating, breathing. All these things are not being used again. So in this way, secretions and all those things, we have a detection source. These are the detection source, that what is coming in the excretions. Though we are now able to detect the secretions and excretions. So we mostly, first of all, depending upon the excretions, that what type of excretions are coming from inside the body. We detect many bacteria, we detect many other things which can indicate us about the internal damages inside the body. Just like bilirubin, biliverdin, we detect it from the blood, and we detect it from the urine as well as the color and all those things. And we say, oh, pointing out to the liver. We detect the urine and we find, oh, it has more glucose, which should not be in that one. Or we can detect, oh, it is something wrong with the pancreas. The same way, if we see gonococcal bacteria in the secretion coming out from the urethra, oh, we can detect it. So the same way about the bacteria, this is what, by saying all these things, I want to convey you that the bacteria are having a particular specific type of site inside the body from where they are coming. The different bacteria have their different sites, mainly inside the body, but their virulency, their toxicity may affect the whole body. It is not that they are localized, just like the tuberculosis, it is localized only to the lungs. No. Their virulency, their toxicity may affect the whole body, and the symptoms are later on produced by the whole body, just like the fever, cough, lethargy, lassitude. All these things are coming up later on in the course of the disease. But what I am talking about, the viruses. The viruses are hidden enemies. Hidden enemies, because they do not have their any home, specific home we do not have about these viruses. They live inside the bacteria. And suppose if there is no bacteria inside our body, then ultimately what happens? The incubation period of the viruses is about 4 days. If anybody is affected or come in contact with the person who is having already affected by the viruses, any type of virus, even the influenza virus, simple thing. If we come in contact with any person who's having influenza, and then ultimately third or fourth day we have sneezing, We have watery discharge, we have itchy eyes, and all those things, symptoms which the other person was having, we produce that, but not immediately, within 3 to 4 days, because the incubation period depends. Every bacteria has a different incubation periods, but I'm talking about the virus. So viruses are having 4 days incubation period. Viruses are having 4 days of incubation period. Within these 4 days, if the viruses, though we are infected with the other person, we are in contact with the person who is suffering from the virus disease. Ultimately, if we are in contact with that, and in our body there is no bacteria, they did not find any home over there to work inside our body. Ultimately, at the fourth day, it will not affect anything. It will not cause any damage to our body. And ultimately, if a virus find out any bacteria inside the body, and ultimately it makes that bacteria their home, and then they start working inside that bacteria, and ultimately flare up the disease. Ultimately, their activities show up the symptoms of that viruses. And good luck again is because nature wants to survive. Nature wants that the life should continue. Their period is of only 21 days. Any person affected with any viruses, if it is producing symptoms, means one thing, that he is having any type of bacteria inside the body. That is why the viral infection is increasing, and person after 4 days is producing symptoms of some kind of a viral disease. One thing is sure, that he is having some type of bacteria. That is why it gives home, shelter to the virus, so that inside your body this virus is growing now, and ultimately it's doing its activity. And the activity period for every virus is up to 21 days. And within 21 days, he can kill the person, or he can die himself. He can leave the person as is. But if within this 21 days a person is complicated and do not, you can say, any alternative to protect himself, then peoples may die with the complications. Most of the peoples are dying with their complications. Most of the peoples are dying because they cannot combat the virulency of that toxin substances. And fever, malaise, difficulty breathing, respiration, all these things are the complications later on. But if these complications are in a limited time, then we can cover those with the medications, if we are having knowledge that if this kind of complication comes, and how we can start the breathing, how we can protect that the breathing should be continued, how we can protect that, yes, it should not affect the lungs anymore, there should not be any damages in the substance of the lungs. If we have mayas, which we are having nowadays, when the COVID started, we were not having this kind of things, but ultimately now we have that one. That how to protect if a person is suffering from any COVID type of infections. Nowadays, the COVID type of infection, this is also a viral infection. It was just like an influenza. When the influenza started in the last centuries, at that time people were killed in thousands and thousands with influenza. But what happened nowadays, this influenza has become a common disease, because our body has developed a resistance against this kind of infections. And then in the beginning of my lecture, I told you about the pox. We were not knowing that how pox is occurring only in one type in the life. Why? Because after once pox is affecting a person, the body itself develops a protective power against this one. Nowadays, we are doing the same thing by the vaccinations. We are generating a center inside the body, that if ever this kind of enemies comes inside the body, they can, in the initial stage, kill them. That's why we are having different kind of vaccination. Measles, mumps, varicella, all these things, vaccination we have developed as far our knowledge is concerned. So now the same thing, that if a virus has affected a person, and if he is not having any bacteria inside his body, means within 4 days, if a person is affected, suppose you are in contact with a person who is having COVID, but inside your body there is no bacteria, what will happen? If you are not having any symptom up to 4 days, even you are going to in contact with the COVID person, you will not suffer from the COVID disease, because your enemy, this COVID vaccine, this virus, could not get home over there to work over there and to kill you and to give you any type of harm, and it goes away. It is already killed. So in this way, even then we take precautions up to 21 days. If it's known that yes, someone has in contact with the person who was having COVID, yes, within 4 days, if he's not producing any symptoms, even then we need to take precautions up to 21 days, so that there should not be anything late coming symptoms or virulency of that one, so that he should not suffer from that one. So in this way, now the fourth enemy which can kill the persons. First was the fungus, the second was the protozoa, the third was the bacteria. There are different kinds of everything. And the fourth was this virus. So viruses are killing. There are different kinds of viruses, and their strains. Every day strains are changing, because one virus is matching with the other one. One virus is matching from male to female. A new generation comes, and that new generation matches with other one. A new generation is coming up. The same way, the strains of each and every viruses and bacteria is changing time to time, and that's why their symptoms are changing time to time. And now our medical science is competent to prepare the vaccination even with the changing strains of each virus. Generation to generation, the knowledge, habits, structure, everything change. But but my grandson will have a different type of character, different type of many things. Though DNA will prevail, my DNA will go to my son to my grandsons, and to their DNA will remain same. That has been detected that from the thousands, millions and million years back, we were having some forefathers, and their DNA is still in us, that they were sometimes here in the earth. That proves that one. The same way, my DNA will go into my grandsons, but the same way, the viruses are having different stains, different stain time to time, because influenza virus, COVID virus, and there are many more different other viruses, and they are making different type of generations time to time, and ultimately we are now able to combat, to follow these things, and we are able to prepare the vaccinations according to the different stains, father to grandfather to father, father to their kids, the grandchildren. In this way, as our generation is changing, plus not changing the DNA, the same way viruses remain viruses. Viruses do not become bacteria. Viruses remain viruses, but their strain changes. Their next generation has changed, means they are able to produce, or they are able to affect our body different way. They are able to produce different kind of symptoms inside our body time to time. That's why sometimes we go to the doctor and say, oh, these are the symptoms of COVID. Okay, yes, this is vaccination has been given, now you are okay. But Next few months or few days, he comes again. Or then he said, oh, you are also suffering from the COVID viruses. But no, that vaccination is not affecting you. You need another vaccination because it is a new strain. It's a new strain. New generation has come up. But medical science is now able to produce this kind of vaccinations, time to time, changing vaccinations, depending upon this virulency or different strains of the viruses. So different strain of the viruses are being detected, and according to that, immediately vaccinations are prepared. That's why we are surviving. And moreover, whatever happens with our body means life. Body is a physical body. Whatever happens with the life, ultimately, second time, life tries to protect himself from similar kind of things and even becomes more stronger. In normal life, whatever happened, whatever the incidences are coming in our life, second time we are aware of that one and we protect ourselves. The same thing this body, this life is doing inside, that when one disease is affecting any individuals, ultimately the second time when that comes up, the person is not having that much virulency. The person is not having that much uh, problem with the same disease, will be having a minimum. Just like you see that I told you just now, the influenza, when the influenza started as a viral disease, it was killing thousands and thousands of persons all over the world, just like COVID has killed in the 19th centuries. The same way nowadays, COVID is not that much virulent. COVID is not that much dangerous. Though COVID has its activity, similar type of activity, but we are more stronger. Lives are more stronger to protect that kind of environmental diseases, that kind of viral diseases, that kind of different type of things. We are able to manage all those things. So this is what yesterday I delivered this lecture in Punjabi and today it was in English. The remaining portion, the routine series of lectures, we are passing through the abdomen because we are describing this whole body, how this life was started from sperm to ovum, how this life was developed inside the mother's womb, how long, 280 days it remained over there, what happened every day. I have described you whatever happening every day inside the mother's womb with that new life. And then ultimately, after the end of 280 days, it has to come up. I have described all the complications. What are complications a life may face inside the mother's womb during 280 days? And after that, when it comes out of that, is known as labor. So, what are the stages of labor? What are the conditions? What are the complications in first stage, second stage, third stage, and all those things I have described systematically. After that, I described that the life is born. We say newborn, basically, it has born 280 days before that, when the sperm and ovum met each other. But even then, before that, because we count the labor from the first day of last menstruation of a female. It means it is 1 month before that one. And the fertilization of ovum occurs within 14 to 21 days of the first day of last menstruations. It means at least 15 days before life was born. And the total of 280 days. That's why sometimes when we say due date of delivery, we calculate the days 280 days from the first day of last menstruations. But we say, oh, it may be 7 days early or it may be 7 days late before this one, because we know that the menstruation has started before that. But at that time, ladies were not knowing that I will become pregnant or not. Ultimately, when it is fertilized, the ovum is fertilized, that occurs after 14th day. 14th day of the menstruation, that ovulation occurs, the ovum comes out of the ovary and then travels into the fallopian tubes, and then it attacked with the spermatozoa, and then it becomes pregnant. It means 14 to 21 days are the period that we may calculate or we may detect it. And if we calculate it, we say it is 280 days for the human embryo to develop in a new life. So ultimately, after the delivery, I have told you about the complications of the boys of the newborn life and also of the mother as well. After that, I told you about the new life. When the new life survives out of a mother, what are the complications? Why people's kids were dying within 1 year of their life? There were diseases, some kind of diseases. For that, we have prepared these vaccinations, and ultimately, vaccination was recovering all those things, and now there are no newborn deaths. There may be where there is no medical science, there is no any this type of approach in the backward countries, but now all over the world, the vaccination has been initiated as a rule that everybody has to take the vaccination. Now there are some complications, some type of reactions you can say of the vaccinations, but medical science is working on that one, so that every person should take vaccination, but there should not be any side effect of those things. There were vaccination, but even then we were advocating, the doctors like me, they were advocating the public that you should take the vaccination to protect a bigger risk, to protect it from the bigger risk. But you should bear small risk. If there is some complication, you should bear it, because it's just like Maharaja Ranjit Singh. Everybody knows that with the pox, he lost his one eye. That's a big loss. But ultimately, if taking a vaccination, because there at that time there was no vaccination, but even nowadays you will not see any person by birth is having loss of sight. No, because we have vaccination, and the newborn life is given vaccination in a routine, and those vaccinations are given up to from 2 months of age. 2 months of age we start the vaccinations, and after that it goes up to the 14th years of life, because we know that now the immunity of the new life has developed himself to the extent that it can protect himself. It can protect himself. So no need to artificial immunity be given to this one. That is why the vaccination process starts from the second month of the life, because many of the diseases, the liver problems and all that, hepatitis B is given just after 1 or 2 months of the life, because at that time the food is different, new food. Because first of all, when it was in the mother's womb, mother was giving everything prepared by the placenta to the child. There was nothing and no complication at that time. But now the child comes out of mother, separate from the mother, and there is a new food. You are giving the milk. From milk, he has to prepare. All his organs are supposed to work to prepare blood from this milk and to develop all the organs in this way. But the organs are not well trained yet. Organs are not and just like orientations. Nowadays, when you go to a new job, they give you an orientation, trained you, and when you are competent, then they left you on its own that you can do work now. The same way, in the initial stage, this body, newborn body, is not competent to work to make food from this. Ultimately, ultimately, in this way, you cannot make food. Yeah, because when there is any call, that creates a problem for me. So I was talking about this newborn. So newborn is not trained fully to digest the food which is given nowadays just in the shape of milk, and ultimately liver has been given a bigger load. First of all, the food was coming from mother by the umbilicus. that was going to the liver, and the liver was nothing to do for that one because that was already prepared. If a mother is having some type of disease, that may sometimes affect the children, but otherwise there is no complication. Food is already prepared to be digested, and liver has nothing to do with that one. But when there is a new food, and now it goes to the liver ultimately, in the circulations, and liver is a type of, you can say, person who has to see through all the food components: sugar, carbohydrates, fat, all these things. It has to separate each and everything, and then ultimately, oh, yeah. So I think only few minutes are left with my program, so I can just tell you about that one. The system is not yet trained for each and everything. The new environment. At that time, the air was oxygen was given by the mother, but now he has to take the air from this environment, which he was not familiar with, and the food was new, and he was not familiar with the food ultimately. So there is some difficulty to adjust different foods. Gradually, it learns. The same way about the diseases. When any disease comes up and it affects the body, and ultimately the next time the body becomes competent to fight with that one, and has sufficient measures to take care of that one. That's why people do not suffer again from the same type of things. Very rarely. Only the acute conditions are coming up time and again. But otherwise, the measles, mumps, varicella, there are many more other hepatitis. All these things, they are not coming on the system. If once vaccination has been given, and up to the booster level, they are given, after that, the children do not suffer from that one. So I have described this life systematically, in the newborn, then toddler's life, then adolescent's life, and then the adult life. There were many more incidences, astonishing incidents I have described in this period with you. And I hope in the next chapter we will be describing, because now there's not much time that I can describe you in this lecture, because we are passing through the abdomen. What are the organs in the abdomen, where they are situated? We have divided the abdomen into 9 different parts, and in each part, what are the organs? And then, if there be any organ sick, diseased, what type of complaints it will show up outside, whether this is concerned with the uh, this is concerned with this one. Yeah, yeah. Because when message comes, it disturbs my mentality, because regularly messages are coming, regularly messages and phones are ringing. But so I think I will continue it later on. It's not the time to continue this thing. Next day, this lecture will be in Hindi, and I will try to repeat all these things which I could not repeat today. I will repeat all those things in Hindi lecture, and also with the Hindi lecture, I will advance into the abdominal organs, where different organs are situated, and if they become sick, what are the indications about that one? Because indications of the kidney are different from the liver, indications of the liver are different from the spleen, indications of the different spleen are different from the intestines. In this way, all the organs have their different indications when they become sick. So tomorrow I will start that chapter, then, and I will give you the information about all the 9 sections. We have divided the abdomen into 9 sections. I will repeat that one, and then I will let you know that what are the indications when any organ becomes sick, and so that we can recognize and we can treat that organs in this way. This is your host, Gurdeep Singh Sandhu, homeopathy consultant. My clinic address is 9701 Sarah and Court, Dublin, California, 94568. Phone number 408-687-1899. If ever you are suffering from any disease at any time, and you want to take a second opinion, you can call me at 408-687-1899. And also, if you want to take treatment homeopathic, scientific approach to your diseases, to your health, even then you can call me 408-687-1899. God bless you all. We'll see you tomorrow, and we will continue the lecture of health education lecture series tomorrow from 5 p.m. Thank you. Thank you for listening.